A UTI starts when bacteria enter the urethra and invade the lower urinary tract. About 80 to 90% of the time, it's caused by E. coli. The bacteria ascend the urethra and migrate up to the epithelial lining of the bladder to colonize bladder cells. Bladder cells that have been infected with bacteria form a protective barrier called biofilm to protect bacterial cells from the body's defenses and promote UTI progression. Biofilms diminish bladder function, which causes symptoms like hesitancy, reduced stream, bladder pain, and urine retention. Once biofilms have been made, bacteria will begin migrating into the upper urinary tract through the ureters. When bacterial cells reach the kidneys, they cause inflammation of renal tissue called pyelonephritis. Tissue inflammation causes symptoms like decreased ureter peristalsis, tubular obstruction, and interstitial edema. Clinical manifestations of a UTI include suprapubic tenderness, flank pain, chills, sweats, blood in the urine, painful urination, frequency, hesitancy, urgency, urine retention, and foul-smelling urine. One of the ways to diagnose a UTI is to get a urine sample. There are two ways to get a urine specimen for culture: midstream catch, which is the most common method, and the catheter specimen method, which requires insertion of a catheter through the urethra up to the bladder to obtain urine. A urine culture allows for identification of the bacteria responsible for infection. Urine microscopy is another diagnostic test that looks at the number of leukocytes in the urine, which can confirm presence of infection. A urine microscopy can also detect presence of blood in the urine, which can indicate tissue damage. Finally, an assessment of the patient's symptoms can be used as a diagnostic test in conjunction with a urine culture or microscopy to confirm presence of the UTI.